So today let's talk about vaginal dryness in menopause. So there is a term we use. We call it genitourinary syndrome in menopause. And it becomes very important because it's surprising that's not just, some women, but there's at least up to 85% of women at some point in their postmenopausal life that they will have these symptoms. The longer you are away from the date of menopause, the worse these symptoms get. So in addition to the hot flashes and the night sweats and the mood changes that you have, having these other urinary and vaginal symptoms can be very debilitating to your quality of life, which is why I wanted to talk about it today, because I do have patients who ask me a lot of questions or who get very frustrated with their symptoms. What does genitourinary syndrome in menopause mean? The symptoms are vaginal dryness, vaginal itching, abnormal vaginal discharge, sometimes even bleeding, and can be as simple as irritability when you're urinating, and you can have increased frequency of urination, or it feels like you're having recurrent infections. A lot of times these symptoms can be thought of as, well, I have a yeast infection, or I probably have a vaginal infection or a bacterial infection or a UTI, and can be mistreated or wrongly treated or not diagnosed. But we always have to keep in mind, and if you have these symptoms, definitely talk to your gynecologist or primary care doctor so that we can diagnose it appropriately, because the treatment is very variable. The other problem that we see is with vaginal bleeding. That happens because of the severe dryness, and a lot of times many postmenopausal women don't talk about these. They take it that, it is probably just menopause, or I will deal with it. And so a lot of times we've seen in studies that women don't even approach their doctor to discuss these symptoms because either they're embarrassing or we take it as this is what it is. But you do definitely should talk about it to improve your quality of life. The other biggest concern also that I see is pain during sexual intercourse, and that is because of the vaginal dryness. And a lot of times it's an embarrassing, topic to discuss, but it is a very important topic for your quality of life. So let's talk a little bit about why do you have vaginal dryness in menopause. So estrogen normally causes a lot of increased mucus secretion in the vaginal walls, and keeps the elasticity of the vagina intact so that there is enough lubrication, there is proper bacterial growth, and that helps over a period of time. When you have menopause or in the perimenopausal phase, the estrogen levels go down. So that increases the dryness, it causes thinning of the vaginal walls. So that increases pain, the tendency to have bleeding, and also to have increased dryness and itching. The bladder wall thins down as well in menopause because of estrogen changes. And the reason for that is because the bladder wall and the vaginal walls are very close to each other. So one impacts the other. And the dryness, it's not as much bladder dryness, but it is more the laxity of the muscle, so that your bladder is not able to hold the urine as well. So you end up with urinary incontinence, increased frequency of urination, or burning and itching in the area. Now, how do we combat these? Number one, definitely bring it up to your physician. Number two, there are many ways to determine if this is related to menopause or perimenopause through your Pap screenings, your regular preventive care screenings, as well as a pelvic exam. How do we treat this? Very simple. One is using vaginal moisturizers. There are many vaginal moisturizers that are in the market that you could use at least 3 to 4 times a week intravaginally that do help. Number two is vaginal lubricants. Usually the recommendations are you use lubricants more just during and for planned intercourse, but otherwise the recommendations are not to use it too often, because the downside to using these more often than not is that it can cause local irritation and actually worsen the symptoms sometimes. And also, if you just use it and not talk to your doctor about your symptoms, we may be missing something much more important like cancers, which we at all costs want to prevent. Once upon a time, we used a lot of hormone replacement. Then it went out of commission because of the data we had on blood clots and what it was doing to cancers and increased risk of heart disease. Now we're back again. After many years of studies, we've seen that who is impacted the most, what does it do to your quality of life, having these symptoms, and how can we improve it. So we have figured out, and the current data says that using low-dose intravaginal estrogen creams, especially in the elderly, women who much further out in menopause, actually has a very big health benefit, because intravaginal creams are absorbed much slower into the bloodstream. They don't have the excessive impact on cancer as we think they do or thought they do, and also very low risk of blood clots. Those who need to stay away from the estrogen creams are those who have a history already of uterine or cervical cancer, or undergoing treatment, who have vaginal bleeding still postmenopausal but has not been checked out yet, or those who have a history of breast cancer. So those are the only people that we say, well, you're not a candidate for estrogen creams, but usually, we are trying to use this more and more because it does make a big difference to your daily life. Who makes the decision on, when are you a candidate for this? It will be your primary care physician and your gynecologist. So definitely you should talk to your physicians about this and address this sooner than later. The second thing to use is also oral hormone replacement. The downside of oral hormone replacement is that it is more systemic. It is all in it goes in the blood, it's absorbed by a lot more organs, and it's a much higher dose. So we are more wary of using that because of the risk of clots and of increased cancers or heart attacks. But these discussions can always be made on time when you do have your routine follow-ups with your doctors or your annual checkups. The one big thing take home is about the genitourinary syndrome in menopause is that please remember, this is not embarrassing at all.